Hello, beautiful people. Welcome to the Mom on the Verge podcast, where I aim to help you improve your sense of joy, purpose, and meaning in this life. We will talk about a lot of different ways we can do this, but ultimately, we'll be working toward finding our way back home to ourselves and remembering that even in the most challenging times, peace is only a breath away. I am your host, Katie Farinas, a mom, nurse, and yogi on a mission to improve mental health and build community in our world. Hi, everyone. Welcome back to the show. Before we begin, I just wanted to make you aware of an exciting opportunity that I'm offering. Next Friday, June the 6th, from 12 to 1:30 Eastern Standard Time, I am offering a free workshop over Zoom that will help you discover your Dharma. So if you're on my email list or you've been listening to my show for a while, you've probably heard me talk about the term Dharma. Last week's episode was all about Dharma, what it is and why it's important. So if you haven't listened to that, I highly encourage you to go back and listen to it. It's only about 20 minutes long, so it's a short listen. But this workshop is going to help you to get on the path to discovering your soul's purpose for being here. So if you have ever felt like you have all the things, right? You have a good life, you have the home, the family, the job, all the things, but you're still feeling unfulfilled. You're still feeling like there has to be more to life than this. Or you're feeling like you're in a career that just isn't satisfying you, or you're feeling anxious or maybe a little depressed. These are all signs that you have lost, you're off the path of your Dharma. So you're somehow veered away from your Dharma. And when we are living our Dharma, we feel all the opposites of that. We feel really passionate. We feel really fulfilled. We feel like we live in a state of flow for a lot of our day is in a state of flow. We feel like we are purposeful and that we are in service to others. Being off of your Dharma will always lead to feeling like there's just something not right. Even though from the outside, maybe it looks like everything is fine. You inside just kind of know that there is something off. There's something missing. And that thing that's missing is you in your soul's purpose. Because when you're there, you know it. You know it. It's just an internal feeling, an internal knowing that you are really fulfilling the reason why you came here. And when you do it, there's really no greater feeling. It's indescribable. There's really no greater feeling than feeling on purpose and passionate and fulfilled, and this intuitive knowing that you are doing the thing that you were meant to do in the way you were meant to do it, and that you're being the most effective, expanded, unbounded version of yourself. So if that all resonates with you in any way and you're thinking, yes, I want to be that person. I want to be passionate and purposeful and fulfilled. I want to be the most expanded, unbounded version of myself. I do feel like something's missing. Then come to the workshop. We are going to do it together. We're going to go through 5 different things, 5 different steps that you can practice that will bring you home to yourself, bring you home to your intuition, start pulling away those layers of conditioning and things that interfere with us being able to access our Dharma and really know what it is. Life tends to layer upon us one layer at a time until we really lose access to who we really are and who we're really meant to be. And this workshop begins pulling away those layers so you can start hearing your intuition and you can start moving towards the things that bring you joy and that you feel really passionate about and that are going to light up your world and make your life feel magical like it should, because your life should feel magical. It should feel like this easeful, magical ride with new exciting things around every corner. So if it doesn't feel that way, and and you want it to feel that way, then sign up for the workshop. There is a link in the show notes, but you can go to momontheverge.org/Dharma workshop. And Dharma is spelled DHARMA. So just either link in the show notes or momontheverge.org/Dharma workshop. And I will see you there next Friday, June the 6th at 12 o'clock. Again, it's a free workshop. And also, if you can't make it to the live workshop, I'm going to send the link out, and the recording will be available for 1 week after the workshop. So if you think this sounds awesome and you really want to participate, but you just can't because of your schedule and what's going on in your life, I totally get it. Sign up anyway, and I will send you the link, and you will have a whole week to listen to it. All right, guys, I hope you enjoyed this show, and I will talk to you at the end. All right. Hi, everyone. Welcome back to the show. Today, I had a really interesting conversation with Gina Abante. She is a licensed clinical social worker and the owner of Change of Mind Counseling Services located in New Jersey. And she started off her career specializing in anxiety, depression, and OCD for pregnant patients and postpartum patients. But she had a child who was neurodivergent 12 years ago and started on that journey of unraveling what was going on with her daughter, and then figuring out how to best help her daughter. And so she's become really involved with that community. And actually, I came to know of Gina through a support group for parents of neurodivergent children that is held at my yoga studio, which I will put that information in the show notes if you are in the local area and this applies to you and you would like to attend. So we talked about OCD a good bit, which actually, according to Gina, she said there's a little bit of controversy, but she feels that OCD does fall under the category of neurodivergent. And then we just talked about what it's like to be someone who's neurodivergent or the parent of someone who's neurodivergent, some of the challenges that these people face, and what's available and what really still has a long way to go as far as being optimal for people who are neurodivergent. And one of the biggest takeaways is Gina really stressed the importance of community, and you'll hear her talk about that in the show, but how when you're experiencing these things or you're parenting someone who's experiencing these things, it's hard. It's not an easy road. And, to have a community of people around you who understand and what you're going through is really, there's really nothing more important than to have that support. So I hope you enjoy this show. I hope you have a few aha moments or you feel seen or heard. I certainly did, and Gina's wonderful. So I will put all of her information, like I said, in the show notes. So if you wanted to reach out to her for anything, she said she's always available. And reach out to me if you have anything you'd like to share. All right, have a good listen, guys. I'll talk to you at the end. Just popping back in here before we start the show, I realized I said Gina's last name wrong. So it's Abundante, not whatever I said before. My memory's terrible, guys. But like I said, her information will be in the show notes. So I will make sure the correct spelling is in there and the correct way of contacting her is in there. Hi, Gina. Welcome to Mom on the Verge.
Hi, thanks for having me.
Of course, I'm excited to have this conversation. You and I connected through a mutual friend, someone I know through my yoga studio, and I think you guys work together. Is that correct?
Yes, so we run a parenting support group for parents of kids with neurodivergence, and we meet there on every other Tuesday, and that's how I how I found out about Jenna is through hosting that group there.
Okay, and that's hosted at my studio, right? Balance Planet Yoga.
It is, yes.
It is, yes, because the signs came up on the wall, and I was like, "Oh, that's so cool!" And then anyway, that's how the trickle down effect occurred. And I'm just excited to have this conversation because I think there are so many parents out there with neurodivergent children. I'm pretty sure there are not enough resources for them. So if this podcast could be a source of support for them, make them feel less alone, identify any resources that are available and any ways that we can, support parents of neurodivergent kids, I would love to do that today.
Yeah.
But also, after you and I decided to do this and, spend this time talking about neurodivergent children, you sent me your bio and your website, and I looked at your website, and through your website, I realized that you support pregnant and postpartum women with anxiety, depression, and OCD, which is so cool and synergistic because I'm a labor and delivery nurse and I have a daughter with anxiety, depression, and OCD. So we're kind of living in the same worlds there. So we'll touch on both of those things. But if you would just introduce yourself to the audience and give a little more detail on what you do and why you chose this path for yourself.
Yeah, absolutely. So I'm a licensed clinical social worker, and I'm located here in New Jersey, but I'm licensed in multiple states. And I have a private practice that's called Change of Mind Counseling Services. And I specialize in anxiety spectrum disorders and OCD because I myself have anxiety and OCD, specifically panic disorder and
Mhm.
OCD. Um, and I know what it's like to walk that life. And there's so few resources for people for therapists, I should say, that truly understand how to treat anxiety and specifically really OCD. That's the hard one.
Mhm.
Um, that this has been my specialization for a very long time. And I really also find that it's so much more prevalent in the perinatal and postpartum populations. And when I first entered the field, there were very few therapists that were willing to work with the perinatal clients. I don't exactly know why that is. I think that they
Mhm.
were afraid of working with them for some reason. And that was, well, a long time ago at this point. But now we have a lot more advocacy and therapists that are willing to work with the perinatal population, which is fantastic. But it still just remains my area of specialty with working with this community and being able to really effectively treat folks that are experiencing perinatal anxiety and OCD and any other kind of mood disorders that can come up. So that has kind of been my professional work for a very, very long time. And then, of course, my children were born, and my daughter, who is now 12, she was diagnosed with dyslexia and ADHD, and that took me in a whole different direction.
Mhm.
And I started going down, that world of understanding neurodivergence and how that so closely gets tied in with mental health and emotional needs. And man, that has really that has taken over a lot of my professional life as well. Now, bridging the balance between the two.
Yeah, these kids, they come into our worlds and they always open a can of worms, right? In some way or another. We wind up down a rabbit hole because of our children, which is fantastic. I mean, it really grows us and expands us, but always, I think, in ways that we wouldn't have predicted when we became parents. Like, you just never know what's going to happen. It's a wild ride.
For sure.
And myself, my daughter, I mentioned, or she really struggles, and OCD is a beast. It
Hmm.
really is. I mean, from my understanding from her therapy, and she's had a lot of it, that it's one of the hardest mental health disorders to treat. And it is so much more than what I ever thought it was when I didn't know anything about OCD. I thought it was about compulsive behaviors like washing your hands or tapping on something or having to make sure you shut off the stove or lock the door, which are all parts of it, but
Yeah.
it's so much deeper and broader than that. And
Yeah.
there's so much that goes on behind like what people can't see, the compulsive thoughts. And so it is, yeah, it's a bear to treat. And I do know that in pregnancy, I've learned that I don't know, do you know if it's the hormones, what it is, but it can really kind of flare out of control during that time period.
Yeah, there's a lot of stuff that gets involved in it. So, yes, according to the World Health Organization, OCD is in the top 10 most debilitating illnesses that people can experience, not even mental health. So it's right up there with like diabetes, heart disease, COPD, like the most debilitating health events in a person's life. It really is a beast. In addition to being the most debilitating, it's also the most misunderstood mental health disorder.
Mhm.
I think OCD has been really stigmatized as it's all about people that are afraid of germs or afraid of getting sick and they wash their hands or they check the lights and the locks over and over again. And that's just such a small piece. There's so many subtypes of OCD. So the ones that we're the most familiar with would be things like symmetry OCD, where people like things to be even and organized, or contamination OCD, which is when people are afraid of germs or afraid of getting sick. But there's so many subtypes that it's wild. I mean, there's scrupulosity, where people are afraid that they have offended God. There's sexual orientation OCD, where people are afraid that they are the opposite sexual orientation that they are, and they've just been fooling themselves their whole life. There's harm OCD, which is what I see most commonly show up in the perinatal community, which is fear that something harmful will happen to either their loved ones or themselves. There's just, I mean, the sky's the limit really on the
Yeah.
different subtypes of it. And because it's so misunderstood, I think people live with suffering for so long, they hide it. They'll do compulsions quietly because they're ashamed of them. They're ashamed of the content of their thoughts. And then on top of it, because there's so few therapists that really understand how to treat OCD, people are getting misdiagnosed. The average of the number that we have is that people go 12 to 17 years without getting accurate diagnosis of having OCD. So people are living their whole life having these thoughts and thinking, oh, I just have generalized anxiety or I just have anxiety, and they're getting the wrong treatment. So it's really life changing for people to get an accurate diagnosis and getting the real targeted treatments that are specifically made for OCD.
Yeah.
And that can be life changing, really.
Yeah. And all those different subtypes that you were listing off, if you really think about that, all of those are occurring in the mind, right? So
Hmm.
you're as a parent or the loved one with this disorder, you may not even know that that person is suffering because it's all happening internally. And I can tell you that that was
Yeah.
my personal experience with my daughter. She was diagnosed at age I'm losing track of time now, but like 12 or 13-ish. And we really only went to see someone because she has chronic migraine. And so part
Mhm.
of she goes to CHOP, which for those of you who are outside the Philadelphia area, that's Children's Hospital, Pennsylvania. And they had a wonderful headache program that required you to see a psychiatrist and a therapist is like all part of the headache program. Because people in chronic pain are more likely to have
Yeah.
anxiety and depression and that kind of thing. And her psychiatrist was the one who was like, I think we're going to send her, like, I want her to take these surveys for OCD,
Mhm.
basically, which I was like, I don't think she has OCD. Now, I will tell you that I saw little things along the way of her childhood that I called tics. I have a brother
Mhm.
with Tourette's, and he has always had tics. And so I thought that it was the same thing. They would come and go. Sometimes they'd be well, bad. They'd be frequent and often and compulsive.
Yeah.
And then she would go for long periods with nothing. But once she actually took that survey, it was like she has the
Wow.
most severe case of OCD that you can have. Like she is not
Yeah.
you know, she's very severe OCD. And I had, as her mother, who was home with her all the time, no idea.
Hmm.
And she was living with all these fears and thoughts that she never told me about. She seemed like a super happy child. And once she started getting treatment and therapy, little by little, stuff started to come out about all these thoughts and fears that she was having basically for as long as she could remember
Yeah.
that she had never told me about. And so, if there's one thing that I could be grateful for that she was diagnosed with chronic migraine, it was that it got her
Yeah.
diagnosed and it got her help. And I don't know that OCD ever goes away. It's my impression that it doesn't. but she's living with it and she's managing it. And, it's a part of her life, it's a part of her world, but it's not controlling her world.
Yeah, exactly. I mean, from my own lived experience with having OCD, it definitely never goes away. There are times that I know I'm more vulnerable to intrusive thoughts happening. So if I'm under stress or I haven't had enough sleep or if I'm sick or, traveling, that's a big one for me. But there's always going to be times that I'm more susceptible to those thoughts sneaking in and getting me.
Yeah.
Um, and for me, it's been about sort of strategizing. If I know
Mhm.
that those times are going to be coming up, that I know I have to really lean into what my skills are,
Mhm.
and lean into the things that I know that help me. Um, so it doesn't go away, but I can absolutely tell you that my life is not in a chokehold of
Yeah.
OCD like it was at its peak. At its peak for me, I couldn't leave my house. I was just totally absorbed in OCD, so anxious, 20 out of 10 anxiety every
Mhm.
day. Like it was awful. And my life is completely different than it was then now. So treatment works. That's that's
Yes.
always my mantra. Treatment
Yes,
works. It's
too.
hard. It's not
Yes.
easy.
Yes.
But it is effective and it
Yeah.
helps for sure.
Yeah, it really does. It really does. And, I think you can do a combination of medications that can
Mhm.
also help. But at least from what I've been told from the mental health professionals that I've worked with through my daughter and through her personal experience, it really was that combination.
Mhm.
And at first it was the combination of meds and the treatment, but I think
Mhm.
for the long-term basis it's been more actually the treatment. It's been
Yeah.
more of like learning. She did exposure therapy, and so learning to
Mhm.
set up her own exposures and learning like what her mind is telling her versus reality, and all those, and learning what her triggers are. Like you're saying, she definitely has that too. If she's sick, if she's overly stressed, travel, all those things, and recognizing what they are and then leaning into her tools to manage
Yeah.
it. Like it's really so important to have that piece. I don't know that OCD can be treated without having that therapeutic piece and learning the tools that you need to learn.
Yeah. I think at least the studies show that medication can be a helpful addition to treatment, but medication alone is not as successful as treatment alone, which is
Right.
so interesting to look at. So, just I could really do a deep dive into the science of this, but
Yeah.
when we look at the numbers and we look at the outcomes, people that do treatment as a standalone versus people that take just medication alone, the results are better and longer lasting for people that do treatment alone versus just doing medication alone.
Okay.
So that's not to say that they shouldn't take medication. Of course, it's a tool, use it.
Hmm.
And if you use the two together, that's where you're going to get the most bang for your buck, so to speak.
Yeah.
Um, and there's a lots of different treatments out there that are available. The most common one that we know about is exposure and response prevention, which it sounds like what your daughter did. That involves doing some targeted exposures, and the response prevention is changing your behavioral response to those thoughts. So not doing compulsions is kind of the shorthand of that.
Hmm.
Um, Another treatment, so I did exposure and response prevention for myself. I also use it for my clients. I think there is a lot of value in that. And then there are some people that either can't tolerate doing the exposures or they do exposure and response prevention and they get to a certain point and they're like, I feel like there's still a lot here and I don't know what to do with that. So then there's another approach we use, which is called inference-based CBT for OCD, which
Hmm.
is almost purely all cognitive. So ERP or exposure and response is really quite behavioral in nature,
Hmm.
whereas inference-based CBT is really looking at the cognitive portion of OCD. So looking at the obsessions, the reasoning errors that we make in OCD, and working really heavily in that cognitive realm for people. I find that the two together is the best outcome, really, because we need that behavioral piece and we need the cognitive piece.
Right.
So there's so many options for, for treatment out there that are extremely effective. They're evidence-based, which means that they
Mhm.
have science that shows that these things work. It's not just like snake oil that we're selling people.
Right.
Um, but yes, there is,
Yeah.
treatment and there is hope out there for, changing someone's life through treatment.
Yeah. And but you do have to find the right person. And you're right. It was my
Mhm.
experience also that um my daughter did many therapists. She did CBT, she did exposure response, she did I'm forgetting all the names of them quite honestly, but she did many different therapies, okay? But she also did just regular talk therapy. There's one that I'm blanking on now, but it's more mindfulness based, but
Mhm.
anyway, I had to find, it was hard. It was not easy
Mhm.
to find therapists who would do those specific therapies. Like I would be calling places and they would say, I can, talk to her about her anxiety and depression, but I don't do OCD.
Mhm.
And so it was a little bit of a, taking a deep dive of trying to find providers who that was their specialty,
Yeah.
which is a shame because
Mhm.
such important work and so many people are suffering. And that, like, it's like a bundle. I feel like that OCD, anxiety, and depression, like they all
Yep.
travel together. They're like triplets.
Yep.
So you can't just treat the anxiety and depression and not treat the OCD. It'll never work that way.
Yeah.
And I think for my daughter, and I can't imagine that she's alone, that the OCD was really fueling. That was the
Mhm.
fire underneath the anxiety and depression.
Yeah.
And so if you don't quell that fire, then you're not going to be treating those other pieces of it.
Yeah, absolutely. I mean, we look at anxiety almost as a byproduct of OCD, or a byproduct of the consequences. So when we look at OCD, there's a line in which it follows. So there's the trigger, then we have the what if, which is, that what if, that maybe, that could be, that scary thing that happens. Then
Mhm.
we have the consequence or the scary thing that would happen if that what if thought came true. Then the anxiety comes. So the anxiety comes as a result of that scary consequence of like, oh my God, what if this awful thing happens?
Yeah.
Then when people, because OCD is such a beast and it takes over your life, that will then drag people's mood down. And
Mhm.
if they're living in these, oh my God, this scary thing could happen, at a certain point, they start living as if that scary thing is already happening or it has already happened, which is called living the fear. And that's often where we see depression because people are living as if this thing is actually happening, not a what if it happens at some point in the future. And that will drag your mood down. And that's where I think a lot of practitioners and clinicians get stuck is they want to treat the anxiety and the depression, but they're not seeing that those things are a result of this mix up between imagination and reality, which is what OCD does. So you really have to, like you said, you got to treat that OCD piece to be able to treat sort of those extraneous emotional responses that people have.
So how would someone know? Because when you're talking about like the trigger and then the what
Mhm.
if and then the thing that might come true, like that's true of just plain old run of the mill anxiety
Mhm.
too, right? So how would someone differentiate between this is generalized anxiety or social anxiety or whatever kind of general,
Yeah.
not OCD anxiety, and OCD anxiety? And how would they do it for themselves? And how would they do it for their children if they're maybe concerned that their child is having,
Yeah.
struggles with this?
Yeah, for sure. That is a great question, and I get it all the time. So the best way that I can describe this is generalized anxiety is based in real life things. So examples might be my roof is leaking, then what if that spot that it leaks is going to turn into mold? Or I went to the doctor, I had a biopsy. What if the biopsy comes back as malignant? That's going to be more generalized anxiety stuff, right?
Okay.
That's things that are the anxiety is born out of real life circumstances, real life things that are happening right now, right?
Mhm.
People worrying about, I don't know, maybe what if I get laid off? Okay, well, this is a pretty awful economy we're living in right now. That's something based in reality. OCD is more far-fetched, more unrealistic, more future-oriented. So it's more of it's not rooted in the reality of the here and now. It's rooted in the what ifs, the could be's, the maybes. It relies almost exclusively on possibility versus what is happening in the world around us. So, for example, probably one of the most common presentations we see is harm OCD in the perinatal population. So, what if my baby dies of SIDS? I see that one several times a week. That is not something that's going to be rooted in reality. If your baby does not have any, history of respiratory issues, no sleep apnea, they had no issues with their birth, there was nothing, no anything that came out of the ordinary, but we're still going to that what if, that could be, that maybe it's possible that this thing could happen. That's where we're looking more at OCD. um, Situations where maybe the baby is older and they're starting to eat, and folks will say, oh my gosh, what if this baby chokes on a grape? What if my baby chokes on a grape? And they go into this imaginary place of now they're imagining that their child is already choking on this grape or has choked, and they're doing CPR and they're doing rescue breathing. That's OCD, because in reality, their child is just sitting there eating grapes in front of them.
But they
So
can,
it's
in their mind, they can actually see this whole thing playing out vividly, is what you're saying.
absolutely, yes.
Okay.
So that for me is the difference between generalized anxiety and OCD. OCD, it takes us out of the reality and takes us into our imagination. And then we're sort of like stuck there, and the rest of the world is just playing out around us. And we're in
Yeah.
that, but oh my God, what if this horrible thing happens? And they're just living in that as if it's happening.
Yeah.
Um, so yeah, that for me is like the easiest way to be able to recognize that. And the same
Yeah.
thing happens with children as well. Kids will sometimes worry about, oh my gosh, what if there's a monster under my bed? Or, what if there's a ghost in the house or something like that? Those are all normal fears that kids have at some point in their life. But when they start to get fixated on one specific thing, and they're ruminating about it, and they're coming and looking for reassurance from their family over and over again. With OCD, it also tends to be pretty selective, whereas generalized anxiety tends to be pretty widespread. With OCD, it tends to be just one specific content that the person's really getting stuck on. So not too long ago, I had an adolescent that was really stuck on the fear of what if she murdered her family. That was the thing that she was stuck on. That you're going to see as more of an OCD thing, where you're seeing your child get stuck on one particular piece of content or one particular obsession, versus like a lot of things. What if it rains today? What if there's a ghost in the house? What if you don't pack my lunch and I forget? Like, that's going to be more generalized anxiety. Um, so that's a more easy way of looking at it when you're seeing it with your own child. Um, it's hard to say though with kids, because anxiety is sort of like I don't want to say a rite of passage, but it's like a developmentally appropriate response at certain times in their life. So I will often say to parents, if they come and they're worried about it, let's talk about it, but also give it some time. So if you're seeing your child, getting stuck or thinking about something in particular, but it's only happening for a short amount of time, I might say, give it a month or so, maybe even
Yeah.
2 months, and let's see how this progresses. If it moves, or they switch on to a different topic, or it just passes entirely, it's very unlikely to be OCD. OCD is something that's pretty persistent, and it doesn't really shift too much. Um, it might a little bit. So if you have someone that has like harm OCD, and maybe they move into like scrupulosity or fears that they do something wrong and offend God, and then God harms their family, but it's going to sort of be in the same vein, so to speak. So being able to just give it a little bit of time and observe, I think, can be helpful with you when you have kids that are experiencing anxiety as well.
Okay. Yeah, that's helpful. I mean, my son actually also has OCD,
Hmm.
but his is much more mild. But I was able to recognize it
Yeah,
because of my daughter. Like, I don't know that I would have thought he was an anxious kid. I would have thought, oh, he's
right.
just like an anxious kid. But then having seen it before, I was like, oh, no,
Hmm.
this is OCD. And, we wound up getting him in therapy as well. And we'll see what happens when adolescence comes, because I feel like that's when my daughter's really blew up again. Hormonal
Yeah.
changes, adolescence, having a baby, all those things. But I went to step back for two things. One, you probably saw me laugh when you said, I'm anxious that there's a hole in my roof and I'm going to get mold, because I literally just had that happen. We had a hole I'm aware of, and we had black mold in my son's closet.
Oh God.
I was like, that is really funny that she happened to pull that example out of thin air. Um, but the other question that I'm asking this out of sheer curiosity is, the way you describe OCD is more imaginary, and this
Mhm.
person's in this imaginary world, which I will say, when my daughter was really in the depths of her OCD, first of all, she pretty much lived in her room, but
Mhm.
anytime she was out, it was like she was there, but she wasn't there. And I think she
Yeah.
was living in these imaginary scenarios. You'd have to like literally call her name several times or wave your
Mhm.
hand in front of her face, because she was like not present.
Yeah.
So that really resonates when you say that about, being in the experience, not just thinking about the experience, but actually like living the experience in your mind.
Yeah.
But along with that goes this beautiful gift of having a wonderful imagination,
Hmm.
which she has always had. It's the only type of play she wanted to play from when she was as little could be. It was always imaginary play. And to this day, she has this spectacular imagination, which I feel like she could learn to harness in really beautiful ways. But is that common that people with OCD tend to be these very like highly imaginative, creative people?
Yes, absolutely. It's the blessing and the curse, really,
Yeah.
because people with OCD tend to be really creative and imaginative thinkers. It's very interesting. If you ever Google a list of um, like playwrights and artists and things that have OCD, that list is expansive. And I don't think that that's a coincidence. I think
Mhm.
that that creativity side of our brain can sometimes, get used for evil when it talks about
Right.
OCD. Um, but it's also a part of us that is what makes us so unique. And
Yeah.
we have this ability that other people don't really have. And it's super common for people somewhere along the line where they start to be afraid of their imagination. And it's like, I don't want to go into my imagination at all because I don't want OCD to sneak in. And then I have to do counseling with people that says like, "No, your imagination is an amazing place to be. Do not discount it altogether. Some really cool things happen inside of your imagination. It's not all OCD. We don't want to chalk it all up to OCD because it's not.
Yeah.
It's being able to recognize when your imagination is being hijacked. That's that key piece of like, it's being hijacked into this place, into you're being pulled into your imagination, into the what ifs, the could be's, like that place versus just your imagination of like all the cool stuff that it does every day, you
Yeah.
know?
Yeah.
Um,
It's true. Yeah. I'm like, you're gonna like write a book or write a movie or like do something, because and she'll always say, like, I'm never bored because it's always so fascinating
uh-huh.
out there. It's just
Yep.
so I don't need anyone around. It's just totally fascinating in my own mind. And I am not like that at all. So it's very interesting to hear her talk, because I'm like, wow, I wonder what it's like up there. I wish I could get up there for a little bit and
Uh-huh.
poke around for a while.
Yeah, it is. It's definitely it's a bit of a wild ride having I often use the analogy, and I use this analogy as well for people that are neurodivergent, but our brains are like Ferraris versus people that don't have OCD or people that aren't neurodivergent, where they're driving with like a Ford or a Chevy. All the same things. We both have motors. We all have the same things. Ours is just a little more sensitive and reacts a little differently than, a Ford or a Chevy or something that, most other people are driving around with. And the trick is being able to learn how to drive it.
Yeah. Yeah. Absolutely. I love that. I love that analogy. Yes, because I do say that to her all the time. I'm like, this is a gift. I know it doesn't feel like it right now. And there are very hard parts of it. No one's discounting
Mhm.
that. But it also comes with these really amazing parts that if you learn how to harness or you learn how to drive it, you can really
Yep.
use it to your benefit. So transitioning into that neurodiversity, is OCD considered, like, where does the line for neurodiversity come in? Like, is that considered a form of neurodiversity or that's separate from that category?
Yeah, so this is like sort of a controversial topic, but from my perspective, as someone who specializes in OCD as well as neurodivergence, I I look at or I classify neurodivergence as anyone who perceives and experiences the world differently than people that don't. So, under that category, I would absolutely see OCD as being a form of neurodivergence,
Yeah.
because we do experience and perceive the world differently than people that don't have OCD. So I absolutely would say that it falls under that category.
Yeah, that sounds like it. And to me, it seems like it fits. Now, why is that controversial?
So I think it's such a hard argument because people that have lived experience know what it's like. We know what it's like to live inside of having OCD and living this life every day. And I think that there are people that are in the mental health world that see neurodivergence as either not a thing or not something you have to be severely impacted in order to meet criteria for whatever, autism, ADHD, whatever it is, and they have a
Mhm.
very narrow view of what neurodivergence is. The reality is neurodivergence is a spectrum.
Mhm.
So, yes, you're going to have people that fall all along that spectrum of people that maybe are impacted less or they have different areas of impact that they can, negotiate and manage differently, whereas people that are have a lot of areas that their life is impacted and they need more support, right?
Mhm.
But I think that it falls along that spectrum, and we're moving in a direction towards acceptance and understanding and
Mhm.
looking at neurodivergence differently in the mental
Mhm.
health field. But I'll be honest with you, we're still working on it, and there are still some people that have sort of a more narrow-minded view of what that means and what it looks like.
And what are the consequences of that narrow-minded view? Is it the services that these people receive, or what, how does that impact the people on that scale?
I think it is, allowing it for better or worse. I think that clinicians act as gatekeepers. And I know that's a word that comes with some fire behind it, but we act as a little bit of a gatekeeper for people to be able to get services and accommodations that they need. So if you have someone that maybe doesn't see or doesn't recognize ADHD, OCD, autism, dyslexia, dysgraphia, all these things as neurodivergence. And they're just diagnosing these folks based off of the DSM, which is the Diagnostic of Statistical and Diagnostic and Statistical Manual of Mental Disorders, which is a very narrow field of meeting criteria for something, then those folks aren't going to get an accurate diagnosis and then be able to go on and receive the services that they need or the accommodations
Mm,
that they might need. Um, which is why I think that we need more clinicians that are able to do broadband assessments and do more neurodiversity affirming assessments for people that looks at the social, emotional, the sensory needs, the executive functioning needs. We're looking at the whole picture of this versus do you meet these criteria? Meaning, do you check off these symptoms? Well, if you
yeah,
don't, then you don't meet criteria for that. Um, so, it's a work in progress, but
yeah,
we
yeah.
definitely need more folks that are able to see this from a different angle to be able to get people what they need in this world.
Yeah. Yeah. And how did you, so you said you have your daughter who's 12 now and has
Mhm.
ADHD. So tell us, like, what was that journey like? When did you recognize it? How did you recognize it? And then what
Yeah.
happened once you did?
Yeah. So, um, I would say from the very beginning, she was my first baby, so I had no frame of reference at
Mhm.
all, but she was always a very sensitive child. She struggled quite a bit with acid reflux, which in and of itself is not, a reason to be a red flag for anything bigger, but she was just so sensitive to sensory things from a very, very early age. She met all of her developmental milestones on time or early. So there was a little bit of this conundrum of, I can tell that there's something here, but, from all the evidence I have and what physicians and doctors are telling me, she's developing normally, right?
Mhm.
And again, she's my first baby. How did I know? And I was not a big babysitter when I was young, so I had no real frame of reference for that. Um, so then she grew up, she started getting a bit older. We homeschooled for her kindergarten and first grade year. And my husband is also dyslexic. So as I was teaching her to read, or starting to teach her to read, he was seeing things that were a red flag. And he was
Mhm.
like, she's doing things that I do. His dyslexia was never remediated as a child, so he's like, "I still do those things, like, I see her struggling in the same areas that I do."
Wow.
And I had other friends that homeschooled their children as well, so I could sort of see, from other people's perspective where she was struggling and, getting some of that reassurance as well from outside perspectives, that she was learning differently than other children her age. So it was in her second grade year that we decided that we should probably enroll her in public school so that she could get the testing and the services that she needed, which was an epic nightmare and probably a bigger conversation for another
Yeah.
day. But they really fought us on getting her diagnosed because they said that because we homeschooled her, she was behind because of lack of education, not because she had a learning disability.
Mhm.
So I had to fight, and we got a lawyer, and I ultimately did our own private testing, and she was diagnosed with dyslexia. The diagnosis for ADHD came later. Really, at that time, the focus for us was getting her the diagnosis for dyslexia because that
Mhm.
was the thing that was impacting her the most at that time.
Mhm.
Um, and then we had to fight tooth and nail to get her services within school, and that's sort of an ongoing thing now, even at 12. But it really was, I knew nothing. I knew nothing
Yeah.
about dyslexia. And even as much I was I still was a clinician at that time, I didn't understand ADHD to the extent that I do now either. Because you think dyslexia is just, oh, they write their D's and B's backwards, or, they can't read things straight. Words are all jumbled up on the page. And that is so again, stigmatizing dyslexia, just like OCD is stigmatized. It's so far. It's like a drop in the bucket to the bigger issue of how these things impact these folks. Um, Dyslexia specifically, it is a region of the brain where people cannot decode words at all. We can't, even with auditory processing, they can't decode the words that they are being told as well. So it's a very challenging piece. Um, and dyslexia impacts emotional and social functioning as well. So it's just such it's another thing that's a beast, really, that is
Yeah.
just, it's such a thing that people just don't understand and need more education in.
Yeah. I did not know that. I didn't, those other pieces that you're talking about, I did not know.
Mhm,
And I think that's pretty common. So we really do need more education on these things.
mhm.
And this, I mean, we could go, maybe I'll have you back and we'll have another episode on every parent I talk to who has a child who is neurodivergent and needs services has the
Mhm.
same story about it being just a nightmare and having to
Yeah.
fight so hard and the school fighting against them. And it is a full-time job
Oh yeah,
to get your child the help that they need.
it is.
And an ongoing, it's not like, okay, I fought and I got the services in place and now that's done. Like, no, it is a never ending ongoing job. And I can say that from personal experience with my daughter as well. Like, it does,
Mhm.
it should not be so hard for parents who are also trying to help their, I mean, first of all, they're trying to
Right.
help their child, but also school is only one piece of helping your child. There's so
Right.
much more that is being done outside of school that you need to attend to. So we could have a whole episode on that. But um all right, so then how did the ADHD come in? Because I've heard that it can be harder to diagnose girls with ADHD because they don't present in the way that I guess a lot of people think ADHD presents.
Yeah, it did for her come in later, just in the last couple of years or so, because we were noticing that and I think this is a very common thing that happens, that as we were remediating the dyslexia, then the inattention of the ADHD for her started to rise and surface. And as she got older, she started to have more. So in girls, oftentimes you get a lot of like irritability or emotional dysregulation, where with
Mhm.
boys, they don't tend to have as much of the emotional dysregulation as girls have. So as we started to deal with the dyslexia and her symptoms of that, not really symptoms, but her ability to navigate that better, so that became less of an issue. Then sort of that emotional dysregulation and the inattention started to rise more to the surface.
Yeah.
And that's when we started to see, all right, there's something else at play here that is creating an issue for her. So we went through and started doing some different assessments, specifically for ADHD, which again is very difficult because if you just go to your pediatrician, they're only going to use one tool, which is the Vanderbilt, which is okay, but you're not looking at the full picture of what this means for your child. That's one area. You're looking at academic behavior.
Yeah.
You need to look at all of it, the social, the emotional, the executive function, the sensory needs. Like there's such a big variety of areas that ADHD affects.
Yeah.
Um, so yeah, that came much later, and I think that this is a really common thing for a lot of kids that have, comorbid neurodiversity is as you start to kind of get a handle on one of them, something else is going to creep to the top there,
Mhm.
and then you start seeing that they were interplaying off of one another.
Yeah. Yeah. And it does seem like it is very common for someone to have multiple diagnoses. Like,
Mhm.
it just seems like they travel in pairs or triplets. Like
Right.
they tend to go hand in hand with one another. And so, I know exactly what you're talking about and have also dealt exactly with that with some of my daughter's issues. And it's like whack-a-mole. You feel like you're playing
Yeah.
whack-a-mole a little bit where you're like, okay, this one's doing so much better. And then this other piece pops up and then you're trying to manage that. And
Yeah.
it's really hard as a parent. It's so hard. And as you mentioned, the supports and services are not always best or the easiest to get.
Mhm.
And our school system too. I mean, I would not consider myself neurodivergent. Not that I don't think I am. I've never been officially like evaluated, but I don't think that I am. I always liked school. School was like, I always enjoyed learning, and like school worked for me. And
Yeah.
I didn't question school at all. I didn't question that I would send my kids to a typical public
Right.
school at all. I bought my house based on the fact that I live in an area with good public school system. But now having two children who I would consider neurodiverse if I'm using the definition that you are using. I am really like, that's like blew a whole can of worms
Yeah.
open because now I'm starting to question that because I feel like our school system is really designed for people like me, for
Yep.
people who are quote unquote normal. I actually really hate that word.
Right.
But who kind of like, I guess, learn in the way that the majority of people can learn.
Yep.
Um, and it's really, really not meant for people who learn differently than
Mhm.
that.
Yeah.
But then the question is, Now what? So,
Yes.
do you have any thoughts on that for parents out there who are feeling like the traditional school system is not serving their child, but they don't know where to turn?
Yeah, I mean, this has been like an ongoing thing for me. I really struggle with the public school system. I think that done well, public school can be amazing, but I think at the end of the day, they're an institution and there's very little that we can really do to change that. I'm a huge proponent for homeschool. I know that, it's just for a lot of people, it's not accessible, and I totally get that. As a working parent, like, I don't know that I could easily go back to being a homeschool family as much as of an advocate as I am for it. But I think we have to really take a look at our own children and find what it is that they need. And that's so hard when they're small because they don't know. They don't know what they need when they're
Right.
little.
Right.
But then as they get older, I think they can have a little bit more input into what works for them, what doesn't work for them, things like that. Private schools are also an option. We have some pretty good private schools in this area that won't necessarily be able to provide the services that your child might need. So if we're talking about IEPs and 504s and things, they may not be able to honor all of the accommodations, but the learning environment is so different that sometimes that alone, you might not need all of the accommodations that you would need in a public school system as well. So it's really knowing, kind of what your environment your child would thrive in. Um, we do, I mean, there's schools in we live in New Jersey, so in New Jersey, we have a fair amount of private schools that specifically cater to kids with dyslexia and dysgraphia and ADHD, and that's a pretty amazing thing as well. Of course, they're pretty far from us, so there's that trade-off as well, as thinking that we have to be able to transport our own children to these schools,
Yeah.
but it's hard. I think it's, really taking a look at and challenging the societal norm of like, no, your kid just goes to public school for 12 years and they just blah, 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 whatever. And then they
Yeah.
do some sort of secondary education outside of that. So being able to kind of push up against that and really look at what does my child need, not what society expects of them and how this is going to go, and being able to be an advocate for that for our children. I don't think you can go wrong if you're going from that angle.
Yeah. I really see it as, we live in the information age. So,
Mhm,
um, not that school's not important. I'm not saying school's not important, but we're living
mhm.
in an age where you can teach yourself, you
Sure.
can
Mhm.
learn pretty much anything. If
Yep.
you're willing to do the research and put the legwork into it, all those things. Um, and I want my kids to be educated, of course, and
Yeah.
get a good education, but I don't want that to be at the expense of their self-esteem and their
Right.
self-worth. And I
Exactly.
think that is what is sometimes happening for neurodivergent children in the standard
Mhm.
school environment because they learn differently, and that difference is not, they're not able to accommodate that difference. And so the
Mhm.
kids are judging themselves against other kids who are able to learn in this way that's being presented, and then they're
Mhm.
feeling unworthy and not good
Exactly.
enough and like there's something wrong with them.
Yep.
And that is my like absolute biggest concern for these kids, and then questioning like how do we help them, how do we help them understand that there's absolutely nothing wrong with them. they
Right.
just they just do it different, and different is not bad or wrong, it's just different.
Right. I think it's hard with the public school system because they're limited in what they can
Hmm.
provide. And there's been a whole debate in the world of neurodiversity with ABA, which is applied behavioral analysis, which is a therapy for kids or any person really with autism, saying that it's ableist, that the majority of that therapy is teaching people with autism to be normal, quote unquote normal. In some respects, I think public school does the same thing. We're trying to provide these accommodations to allow these children to act normal, to be able to assimilate in with normal. What kind of message is that? Like if your kid is struggling with test taking, maybe it's not just that they need extra time. Maybe they need a completely different format to test what their retention is, like
Yeah.
so it's very challenging. And I don't think
Mhm.
that as much as we can try and push and look for reform and all these things, ultimately we're fighting an institution. So
Yeah.
there's only so
It's
much we can
true.
do with that.
Yeah, it's true. And they, also, I don't want this to sound like I'm coming down on schools. Like I don't,
Sure. Yeah.
schools have a lot of kids. They have a
Yeah.
lot of kids and they have only so many teachers and only so much money. And, I would like to believe that all the teachers and the administrators are doing the best they can
Hmm.
with what they
Yeah.
have to work with. Um, and it's very hard to individually teach to each individual need of each student, and I 100% agree with that. It's that I just think these conversations need to be had so we start thinking about
Yeah.
what we can do in the future to
Right.
better assist people who
Sure.
are neurodivergent in learning, and maybe that's outside the public school system, or maybe it's
Right.
a branch of the public school system, or I don't have an answer.
Yeah.
But just bringing awareness to it and talking about it, and then maybe some genius out there will be able to think outside the box and figure out how we can better serve these kids so that they can perform their best, they can be their best, they can feel good about themselves, they can,
Yeah.
because so my brother has autism and ADHD.
Yeah.
And his, oh God, his academic years. I mean, he's almost 50, so we're talking about, many
Sure.
years ago, but his academic years were just it was just terrible. And he is brilliant. Okay.
Mhm.
He is so smart, but he was never able to express that, or that was never
Mhm.
seen because he was being asked to fit into this box that he just literally could not fit into.
Right.
And, he's made a beautiful life for himself. And, it's in the end, it's all good, except for I'm sure he carries a lot of feelings about that
Sure.
with him. And there may have been dreams that he wanted to achieve that he felt he couldn't because
Yeah.
he wasn't good enough, or he wasn't whatever, he couldn't follow the standard path. And
Mhm.
so that made it challenging. So yeah, that's I just want to support these kids in
Yeah.
any way that we can to achieve their dreams, you
Yeah.
know?
My thinking is, you know, life is hard, and under the best of circumstances, life is very challenging. And we know that for people that are neurodivergent, life is going to be even harder. And we want to try to, you know, reduce that difficulty as much as we can. We don't need to make everything so much harder. It's
Yeah.
already hard enough. So, yeah, if kids are going to struggle, I'm sure your brother would say the same, like, yeah, life was really hard, but like school on top of it made it even harder. It would have been
Yeah.
something. There was a million other areas of his life that
Yes.
made him feel like he wasn't good enough. We
Yeah.
didn't need to have this one be extra, more of that.
Right. Right.
And you're right, there is no good, like, answer for making any of this better. But I think that our generation and the younger generations are kind of moving in that area of like, no, we don't have to do things how they have always been done just because they've always been done that way. We can think of different and more creative, getting back to that imagination piece.
Yeah.
We can think of more creative ways to be able to help support people in their educational experience, but it doesn't have to be what it has always been, like the
Right.
traditional way.
Yeah, absolutely. And I do think that this is, first of all, we're just all changing and it's a different world than it used to be. And women are stepping into their power so much more and
Yep.
saying, like, this is my child and this is not good enough. And like, I'm going to fight to the death, to
Uh-huh.
do the best I can for my child. And I think there's less of like, oh, that kid's just a bad kid, right?
Right.
Parents are not making that assumption like they did many years ago. And they're saying something's wrong. Like, I feel like something's wrong. And then they're
Yeah.
doing the legwork to get a diagnosis and figure out what's going on beneath this undesirable behavior.
Sure.
And so it seems like the number of children who fall into this category is much bigger than it ever was before.
Mhm.
I don't know that it actually is a difference, but it's a difference in the amount of kids who are diagnosed. Would you agree with that? That it's probably been a stable number that we just didn't recognize in the past?
Yeah, I mean, I think it's always been here. I think the awareness and the assessment tools we have now are much better. I think, I saw this meme not too long ago that was like, autism was not at the rates that we have now. Yeah, sure. So grandpa who ate the same thing every single day and wore the same outfit every single day was totally neurotypical. Like we didn't see it the
Yes.
same way. And I think people masked a lot differently than they did now because they had to, because if you didn't, you get thrown in an institution, which is a whole
Mhm.
other thing. But I think the way that we have, we're moving towards that acceptance and, being more open about allowing people to express their authentic selves is so
Mhm.
much different now. So,
Yeah.
yeah, the numbers seem like they're higher, but it's really just that we're more aware and able to identify these folks earlier than we ever were able to in the past.
Yeah. Which comes with many benefits, including getting your child the services that they need as young as possible, right?
Mhm.
But also like the power of numbers. So the more people who are in this boat together and saying what's available is not good enough and we want better, can fight together to make change.
Mhm.
Which comes to my other point, which is, you mentioned the support group in the beginning of class. So how important do you think it is as a person who's neurodivergent or a person who has a child that is neurodivergent to have some form of community and support in their life?
Oh my gosh, like it's irreplaceable, honestly. So I started that support group because I was struggling. I was like, I don't know if I'm raising these kids right. Like, I don't, what am I screwing them up? Like, I need to be able to talk to some other parents who are going through this or have been through this and can we can talk about this experience because I can't relate to other people my age that have kids that are the same age as my own kids and they don't have to worry about, going places and their kids having a total sensory meltdown, or they don't have to worry about the the drama of bedtime because something isn't right, or the kids are struggling to sleep alone. They're it was just such a unique experience that I couldn't relate to parents of kids that are neurotypical. And I was like, I need to talk to someone about this. Um, so we started this group, and the overwhelming response from other families is the same. Like, thank God we have other people that are going through this, and we can just lament and share ideas and share different services and things that worked for them, and just have other people who know what this is like and get it. Um, so I have to imagine that it's the same for people that are either newly diagnosed or are diagnosed, and they need to have that community of like-minded folks, that they can relate to and they can connect with, and on whatever that looks like, whatever that social level looks like. But I think that that is one piece that is completely irreplaceable.
Yeah, I agree. I agree. And having my parenting experience is very different than the parenting experience of
Mhm.
someone with children who don't have these struggles, these challenges. And it is very hard to relate,
Yeah.
because you feel like you're not even doing the same job. It's
Right.
not even, it's apples and oranges. It's just not the same at all. And so yes, having that support is like it's huge. And I think a lot of parents now, because parents are becoming more aware and are, getting their children diagnosed earlier. I hear a lot of parents of kids who are neurodivergent say, "Oh my God, like I
Mhm.
had ADHD."
Mhm.
Like,
Oh, yeah.
I had no idea, but I see all this stuff in my child that is so reflective of my own personal experience, and their diagnosis, like it's like clear as day now that they know, but their whole life they were just walking around feeling like there was something off about them
Yep.
and not knowing what it was. And even just having my husband and I were talking about this yesterday, that even sometimes just having a name for something is such a relief.
Yeah.
Like it's like, oh, that's what that is. Oh, okay. Okay, it has a name. And it has like things that belong to it that fit and feel like me.
Yeah.
And there are services available to like get help with the things that I'm struggling with. Like it's huge to be able
Yeah.
to just have the diagnosis.
Yeah, absolutely. Because I think it's far worse to walk around and think that you're nuts and there's something wrong with you, like fundamentally wrong with you, that, you struggle to make lasting connections or sensory wise, emotional wise, executive functioning, like all of it, just feeling like there's something fundamentally wrong with you and other people are doing it better. It's
Yeah.
far worse to walk around for your whole life thinking that, then, oh, this is a symptom of
Mhm.
a bigger thing in myself. And I can have acceptance and be like, okay, this kind of sucks. And like, let's find a way to work with this. I might not be able to eradicate it completely, but I can find some tools to kind of find as workarounds, some accommodations. So I might not be able to do it the way that everybody else does, but I can get the job done in a different
Right.
way.
Yeah. Yeah. And so my husband and I were talking about this yesterday because I 100% think that he has ADHD, that was never diagnosed. And I grew up with a brother with pretty severe ADHD. So I'm very, the symptoms are very familiar, just like when my daughter had OCD. And then I looked at my son and I was like, oh, yeah, you have OCD. Um, and he's always, again, we're 40, almost 46. He's almost
Yeah.
46, like wasn't diagnosed as, commonly
Mhm.
back then as it is now. He was always able to compensate. That's another big
Yeah.
thing. Like a lot of these people they're able to compensate. So
Yep.
they can push through. It might not be as easy, but they can push through. And he was definitely one of those people. And as life has gotten more overwhelming, there's been a lot
Mhm.
more stress and a lot more pressure. I feel like it's not as easy for him to mask his symptoms and push through. And so we were having this conversation about, the importance of having a diagnosis and being able to get services and learning how to, because, things don't have to be as hard as they are, is what I was trying to
Right.
say. Like they might be harder than the average person still, but they don't have to be as hard as they are now.
Right.
And that's a huge relief.
Oh, yeah.
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 When you're swimming upstream and then to be like, "Oh my god, I'm swimming against the current of like tsunami," or
Yeah.
am I gonna swim up the creek? Like it's
Right.
just very different amounts of effort that we're
Exactly.
putting in. Yeah.
Exactly. Yeah. I think, again, we don't have to, and there's some of that, like, that mindset of like, this is how it's always been done and this is how it should be done. Like, no, that's how some people do it. We don't have to do it that way. There's more than one way to skin a cat. If you have a particular outcome that you would like to see happen, let's find another way to get that done. But it doesn't have to be so painful and like you're like dying trying to get
Right.
to that outcome.
Right. Right. So I want to keep us on time here. It is already 12:11. I'm sorry we went over time.
Okay.
I could talk to you all day. But if you had like, something that you would want to recommend to people either who are neurodivergent or parents of neurodivergent children, like is there something like that you feel is really important for them to know?
Yeah, well, I think it's important to know that we are all struggling through this. So,
Mhm.
being a parent of neurodivergent kids there is absolutely no playbook for this. There's even less, there's no parenting book out there for kids that are neurotypical, and there's even less out there for those of us that have kids that have learning differences and neurodivergence. So, we are all struggling through it together. Finding people that you can have in your community, surround yourself with other parents that have kids that are similar. They're going to get it. They're going to be able to validate this experience for you, and you will feel heard and understood, and being able to know that, like, yeah, this was not what we thought we were signing up for, but here we are, and let's do this together.
Mhm.
I think that that is huge. There's lots of different, like online things like for autism and ADHD. There's all kinds of different publications that are available out there for just educating yourself as to it. But I really think one of the most important things is having people around you and a support
Yeah.
to not only support, like, yeah, you're doing this right, but also like, let's just talk about this experience because it is wild
Yeah.
and it's it's so different than likely what anyone else around you is going through.
Yeah. And it's so hard. Like, let's just be honest, it's so hard.
It
And
is
sometimes,
very.
yeah, having people to hold you up, because we all go through periods where we feel a little stronger and sometimes we feel weaker. And the strong, the people who are in the moment of strong can hold up the weak. And then we can do, the opposite for each other because it's a roller coaster.
Yeah, absolutely.
All right, I love that. I will put the information, well, I'll put all your information in the show notes, of course, but I'll also put the information for that particular support group, the one at Balanced Planet Yoga, in the show notes for anyone who, it lives in the area and can get to it. I think that's
Yeah.
awesome. But we also live in a world where we can connect through the internet and Facebook
Yeah.
groups and things like that. So yeah, if you're out there, if you're listening, if you need support, then look for it because it really is huge.
Yeah, and anyone is welcome to reach out to me. I can sort of like guide you in some different locations. We have been thinking about starting up a virtual, like a Zoom group for this as well, because we know that there are people that just logistically can't make it down to Marlton, New Jersey for
Right.
for a group. So by all means, people can reach out to me and I can help point you in some directions and we'll just kind of go from there.
Yeah, awesome. Thank you so much, Gina. And thank you for all the
Yeah.
work that you do. It's invaluable.
Yeah, thanks so much for
Yeah,
having me on. This was great.
of course. All right. Have a wonderful day.
All right, see ya.
Bye bye.
Bye.
All right. I hope you enjoyed that. As usual, I felt like I could talk to Gina forever, and there was so much we didn't cover. I feel like we just scratched the surface of this topic, but I hope there was at least one thing that you can pull from this episode that was helpful to you. Um, And I would love to hear what you think and what you'd like to know more about, because I would really like to support this community and do anything I can to help this movement along, which is what I think we're seeing. I think, Gina and I talked about how more people are being officially diagnosed with one of these things that puts them in that neurodivergent category. And so the numbers are growing. They appear to be growing, even though they maybe were these same numbers all along. But with the diagnosis comes a community of people that can support each other and also work together for change. And when people come together, often they come up with creative ideas and solutions and they think outside the box, especially moms trying to help their kids. They're always thinking outside the box. So I would love to, help in any way that I can. So if there's anything that you think that I could do or this show could do, please email me at katie@momontheverge.org and let me know. As far as a mindful moment for this week, I would suggest that given this topic that we're talking about, neurodiversity, that you really take some time to reflect on yourself, on your children, to see if you feel like you fall into that category or your child falls into that category, and if you need to start doing some digging. And if not, if you're firmly outside of that category and you and your children are, maybe to reflect on some people that you have in your life who may fall into that category, and maybe taking a moment to reach out to them and ask them how you could assist them, if there's anything that they need or anything that would be helpful to them that you could provide. Because it is a harder road. People who fall into this category, they do have to deal with some challenges that the rest of us don't. So in any way that we can support them, I highly encourage it. All right. Have a wonderful week. And as always, contact me if you have anything to say, because I just love hearing from you guys. Okay. Bye-bye. Hi, everyone. If you enjoyed this episode or any of our other episodes, I ask that you please like the show, follow, subscribe, or share. The way that podcasts work is the more people that do one of those things, the more likely it is that when someone's looking for a podcast to listen to, our show will pop up for them. I started this podcast because I really see there's a great need in our world for people to feel more peace, joy, love, and acceptance in their lives. And I think we can do that when we have a greater sense of self-awareness. We could become conscious creators of our own lives. And I'm seeking to do that for as many people as possible. So if you could help me by liking, sharing, or subscribing to the show, I'd really appreciate it. And hopefully someone hears a conversation that changes their life. Thank you again, and I'll see you next time. Much love.